It looks like great. We're recording in progress, so I want to welcome everyone. We're up to 1,200. We've got another 1,000 or so that come in, but to be mindful of everyone's time, especially Mr. Canizera, we want to get started. And because this is a busy time of year for active employees, particularly union presidents dealing with the city of New York, Mark has been very accommodating and made himself available just to say hello. And before he goes on to his next meeting with either the state or the city or God knows who. So Mark, it's all yours.
Thank you, Doug, and thank you, everyone, and good afternoon. Yes, I do have to apologize in advance because I do have to hop right off. I have a meeting with the state. Actually, it's a 2 o'clock meeting, so I'm attending that a couple of minutes late. But I would like to thank everyone for participating today, and we know how important this topic is to you. And if we didn't, it was certainly confirmed by the number of people participating today. You know, your healthcare is something we take very, very seriously. It is also a plan that we all know we hope to live long enough and be healthy enough to graduate to someday. So we think we put you in some pretty good hands here today. And I think after you hear the presentation, any questions that you may have or concerns should be answered. I know that Doug put together a list of questions that many of you sent to him ahead of time. And I have to thank our partners from what we're now calling the Alliance, who have come together for many, many of these meetings, some with CSA and others with other municipal labor unions around the city to sort of answer any questions and allay any fears that you may have. But with that, I am going to turn this back over so that you have as much time as possible to get as much information as possible. And please feel free, remember, reach out to Doug, myself, or anyone here with any further questions that you do have going forward. And we will try to certainly help out and get anything answered that we can. And I do also have to publicly thank Doug because I know he's been trying to keep up with the mass number of emails that have been coming in and responding to them and answering my questions and concerns, as well as the questions and concerns I'm getting directly. So Doug has been certainly working overtime the last several months to try to make sure that everyone has the answers they need. So thank you. Thank you all. I am going to hop off now, but I'm certain from hearing this presentation once before that you're going to get a tremendous amount of information and many, if not all of your questions will be answered. Thank you all so much and have a great day.
Thank you, Mark. And like you mentioned, the questions that you submitted to me previously before this when you were registering, I put them together, grouped them sort of by topic. You should all have received a copy of those with a copy of Kim's presentation. If there are other questions at the end of this, please send them to me again. If it's something that I can't answer, or if it's an individual thing we can take care of, if it's a general one that hasn't come up before, I will submit it to Kim and Samantha and Marlon and Melissa, and they will get back to us so that we can get it out to everybody. Please continue to check your spam folders on your email. When we send that, for whatever reason, when we send mass emails out, Gmail and all, because it comes from the webmaster, thinks it's junk. So, you know, check that every day or so to look for messages there. If you have, if you know of CSA members who are not getting our emails, let me know. We may have an old email address or something, and we'll do whatever we can to make sure that we can get everything taken care of for you. So I'm going to turn it over now to the representatives from Alliance. I'm going to start with Kim. She can take control, introduce her colleagues, and we look forward to hearing what you have to say, Kim. Thank you, and thank you for being here with us. We truly appreciate it.
We appreciate the opportunity to be able to present to your retirees. Melissa, if you could pull up the presentation, and I'm going to introduce my colleagues. I have Marlon Pavone. First of all, I'm Kim Parker. I'm the account executive that will be managing the City of New York Medicare Advantage Plus program for the City of New York, and my counterpart, Marlon Pavone. I'll turn it over to you.
Hello, everyone. Hopefully we're here to answer a lot of your questions. I know there's been a lot of anxiety on changing into a new plan or this plan offering. But as an account manager, one of my jobs here is to try to help all the members and try to help the plan itself and TSA in trying to resolve any of those issues should they arise. So as a team, we're here to serve you.
Samantha, if you wanted to
Hi.
introduce yourself.
Sure, I'm Samantha Hayes from Emblem Health. I'm an account executive. So I'm also here to help answer questions. I will be probably presenting during the presentation on some of your drug rider questions. So more on that later. And thank you guys all
Great.
for attending.
Thank you.
And I would, it is up. Thank you, Doug.
Like I said, there's learning curves in everything. It's the first time we've done one this big, so there we go.
No worries.
That looks perfect.
Okay, good.
Thank you, Melissa. I appreciate it.
Uh-huh.
Well, first and foremost, I want to welcome everyone here today. My goal is to provide some additional information, answer all of your questions, and give you a sense of comfort in regards to the new Medicare Advantage Plus program that the City of New York is offering to the city retirees. You go right to the next slide. What I'm going to be talking about today is really just a general overview of how Medicare Advantage works, specifically how the New York City Medicare Advantage Plus program works. I'll spend some time talking about the national provider access. We'll talk about the enhancements to the program. I'll do a high-level benefit comparison. We'll talk about some of the enhanced prescription drug rider benefit that's offered through Emblem Health. And then we will go into some of the questions and answers. I will try to address some of the questions that have been submitted in advance during the presentation, during different portions. Melissa, you can move right to the next slide. This is a general overview of how Medicare Advantage programs work in general. So as a contracted carrier with Medicare, we are required to cover everything that traditional Medicare covers today. So as a bare minimum, we have to cover everything that's covered under traditional Medicare. So today you have your Medicare benefits, which are divided into two parts. Your Part A benefit, which is your hospital benefit, your Part B benefit, which is your provider or medical doctor's benefits. And then for many of you, you have the senior care plan that wraps around Medicare. So you really have three separate parts with traditional Medicare and the senior care program. You have your Medicare card, you have your Empire card for hospital benefits, and then you have your GHI card for your doctor's benefits. Under the Medicare Advantage Plus program, we are going to be combining all of those pieces together under one program. So you will have one identification card that will cover all of those services. And you will also receive one explanation of benefits for medical and hospital services. So you're no longer getting an EOB from Medicare and then an EOB from Empire or an EOB from GHI. All of those pieces are combined together into one program. Now, in addition to all of the services that we're required to cover that are Medicare covered services, there's also some additional enhancements that will be covered under the program that you don't receive today through traditional Medicare or the senior care plan. I will be going into many of those in a lot more detail a few slides later, but just to call a few of them out, the new program will have silver sneakers. You'll have a non-emergency transportation benefit. There's also a healthy meal benefit and a pantry benefit, as well as fitness tracker. I like to say that a Medicare Advantage program is not simply a payer of claims, but it's actually a healthcare delivery system for members. And the program is designed to help members manage their chronic conditions better, give them incentives to have wellness and screening services done. The ultimate goal is to improve the health outcomes of the member, which in turn is a healthier, happier member, and the program runs better. Now, the program is different from traditional Medicare. So we're required at a base minimum to cover everything that traditional Medicare covers, but the mechanics of how the program works is slightly different. One of the questions that comes up quite often is the need for pre-approval or prior authorization. and what that means to members. Currently today, traditional Medicare does a retrospective review on the back end. Under a Medicare Advantage program, that review is done on the front end through a pre-authorization process. Now, we are required to follow all Medicare guidelines and the same medical necessity guidelines that are in place with traditional Medicare today. So those same guidelines are adhered to, but the mechanics of how it works are different. They're done on the front end versus retrospectively. So a member could have a service under traditional Medicare. Medicare could review that service, that claim after the service was rendered. And if it doesn't meet medical necessity guidelines, Medicare could actually turn around and deny and reverse that claim. And then the member is responsible for that bill. So with the pre-authorization process on the front end, there's no surprises for the member. They know that the program, the service is going to be covered and all Medicare medical necessity guidelines have been met beforehand. Now, the prior authorization is handled by the providers. So this is not something that the members have to initiate or engage. It's handled all by the doctors behind the scenes, and they will work directly with the plan to initiate the prior approval for the service that needs the prior authorization. Most services, the typical services that require prior authorization are your planned hospital admissions and surgeries, complex diagnostics like CAT scans, PET scans, MRIs, your therapies like your physical therapy, radiation therapy, or infusion therapy. Those are the typical services that would require the prior authorization on the front end. Typically, prior authorization depends on the urgency of the care that you need and the type of care, type of service that you're receiving. So if you have an urgent or an emergency situation where you need to have a certain service done right away, there's an expedited process so that that prior approval is done on an accelerated basis. And those could be approved within 24 hours. But if it's something that's a planned procedure that's down the road, then it would probably just take a couple of days. We have to adhere to the CMS requirements of timely approvals for pre-authorizations, and that timely approval is within 14 days. We exceed that. So we typically have all of the prior approvals complete within 3 to 5 days, maybe a week. So that's how the process of the prior authorization works. It's just different. Medicare does it retrospectively. A Medicare Advantage program does it on the front end. Melissa, you can move to the next slide. One of the most important items or questions that have come up during these retiree education meetings is the access to providers. And under the New York City Medicare Advantage Plus program, it is a national PPO program, which means that you will have access to any Medicare participating provider across the country. And currently today, there's approximately 850,000 providers that participate with Medicare. And of those 850,000 providers, over 640,000 of those providers are actually in-network contracted providers with the plan, which means that they are either an Emblem Health provider, Empire provider, or a Blue Cross Blue Shield national provider. So there's a large network of in-network contracted providers that are actually in the program. And currently today, over 90% of the providers that City of New York retirees are accessing today are in-network contracted providers. So there's a very good chance that many of the doctors that you're seeing and using today are actually Blue Cross Blue Shield providers. But I do want to emphasize the fact that you're not bound to a network. So even if they're not a network Blue Cross Blue Shield provider or an Emblem Health provider, you will still be able to access those providers as long as they are a Medicare participating provider. I want to spend a few moments just to focus in specifically in the New York area. A lot of questions have come up in regards to what hospitals participate in the network. Every New York hospital participates in the Medicare Advantage PPO network, with the exception of Memorial Sloan Kettering and Hospital for Special Surgery. Those two facilities will see Medicare Advantage members on an out-of-network basis. So they will continue to see patients on an out-of-network basis, but I will let you know that we are in the process of negotiating an in-network contract for both of those facilities. And we hope to have full closure on those contracts within the next 30 to 45 days. But we do have verbal commitment from both hospitals that they will continue to see Medicare Advantage PPO members on an out-of-network basis. Now, if you're not in New York and you live in other areas of the country, you will have access to the National Blue Cross Blue Shield network. So if you're in Florida, for example, you will have access to the Blue Cross Blue Shield of Florida providers. If you live in New Jersey, it would be Horizon Blue Cross Blue Shield. So it's the National Blue Cross Blue Shield network. And there's a few easy ways for you to verify if your providers are in network. And a lot of members like the comfort of knowing that, yes, my provider is in network and all is going to be set. So Melissa, if you move to the next slide, it'll go into a little bit of detail as to how you can confirm if your providers are in the plan, participating in the plan on an in-network basis. One of the ways is you could call the New York City Medicare Advantage call center, which is the 833-325-119 number, 90 number, and the representatives can help look up providers for you. Or if you want to go online yourself and look up providers, you can do so using the Provider Finder tool under Find Care. So you'll log into empireblue.com. You'll go to the Find Care section. You can click on as a guest, so you do not need to be a member of the plan yet. So click on as a guest. The type of care you'll be searching for is medical. You'll toggle down the state that you want to search for providers in. The type of plan is Medicare, and the plan network is a New York City Medicare Advantage Plus network. And then you'll come to the search screen where you can look based on specialty type, provider name, zip code, town, any type of search criteria to be able to look up providers. You can go to the next slide, Melissa. I touched upon this earlier, the enhancements to the program, and these are all additional benefits and services that will be included in the Medicare Advantage Plus plan that you don't currently receive today through traditional Medicare or the senior care program. The first one is Silver Sneakers, which is a free gym membership. There are over 16,000 Silver Sneaker locations throughout the country, and you're not locked into one. So if you spend a few months in New York out of the year and then a few months in Florida, you can switch Silver Sneakers locations to the area where you're living. So it's portable, it goes with you. In addition to the 16,000 gyms that participate, Silver Sneakers also has online classes as well as in-home activities. So if you don't live close to a Silver Sneakers location, they also have additional programs that are there to support members. The non-emergency transportation benefit is 24 one-way trips to the doctor, hospital, or pharmacy. So it's basically a car service that you can arrange. We typically say you need 48 hours to set up the car service in advance. And the Concierge Health Guide, I skipped over this. This is actually the customer service team that will be supporting the City of New York retirees. And I like to call the Concierge Health Guide, it's really customer service on steroids. So this customer service unit is not just going to be there to answer simple benefit questions, look up claims, and give you general information. They're actually there to help the member engage in the plan and get the most out of the program. So they will actually go to the extent of getting on the phone with you to help schedule the doctor's appointments. But these guides will also help you set up the non-emergency transportation benefit or order the fitness tracker or get you set up with the healthy meals or the pantry benefit. They're really there to handhold the retiree and the member to make sure that you're getting the most out of the program. Now, the healthy meal benefit is actually set up for primarily post-discharge from the hospital. Members will be eligible for up to 56 meals per year delivered to their home after they're discharged from the hospital, or they could qualify for the healthy meal benefit if their A1C level is elevated or if their body mass index is a certain level. The healthy pantry benefit was set up specifically for members with certain chronic conditions. It's proven that through some positive dietary changes, certain health conditions will have improved outcomes. I always like to use a diabetic or a cardiac patient as a good example. Those types of members will get a shelf-stable pantry box delivered to their home each month, as well as a nutritional counseling session telephonically with a dietitian every month to make sure that they're keeping on track. We're also including in the program wellness rewards, and this is set up to reward members for doing their wellness screenings and preventive care. So when you have your annual physical, or you have your colonoscopy or your mammography, those are the types of activities where you would be eligible to earn rewards dollars. So every time you do a preventive screening, you will have the ability to earn a reward gift card. We also have coverage worldwide. Urgent and emergency care is covered anywhere in the world. Traditional Medicare does not cover you outside of the United States. So this is a big improvement to the way the current program works today. You would be covered for emergency care for a $50 copayment. Urgent care would only be a $15 copayment. And if you were admitted into a hospital while you're overseas, that would also be covered, and you would only be responsible for your $300 copayment. There's also the health and fitness tracker, which is basically a free Fitbit that members would be eligible for every 2 years, as well as accessing the online health and fitness tracker program that links into the Fitbit. Now, all of these services that are available to you will be included in the program and easily accessed as of January 1st, 2022. The Concierge Health Guide will be there to help assist you if you want to initiate any of these programs. So they will assist you on going online and requesting your health and fitness tracker, or they will help initiate the healthy meals or the pantry benefits. So please utilize the Concierge Health Guide to help you access all of these additional enhancements that are included in the program. Melissa, you can move to the next slide. This is a high-level benefit comparison between the Medicare Advantage Plus program and the GHI Empire Senior Care Program. And I recognize that not every member has the senior care program, but the majority of the City of New York retirees are covered under senior care. This is going to be the replacement for the premium-free base program. So the New York City Medicare Advantage Plus plan will be the program that all Medicare eligible retirees are going to be automatically enrolled into for the January 1st, 2022 effective date. Retirees will have the opportunity to opt out if they do not want to be in the Medicare Advantage Plus program and you want to keep the current program that you're on today, whether it's senior care or HIT VIP or the Aetna plan or Empire Medicare related. So you will have an opportunity to opt out. If you choose to opt out of the program and keep your current plan, the retiree would be responsible for the buy-up premium to keep the current plan. So for senior care, the buy-up premium is $191.57 for the base plan and $2.83 for the 365-day hospital rider. So it's roughly about $194 per member per month to buy up to keep the senior care plan. So the benefits themselves are fairly close. The annual deductible will be $253 under senior care as well as under the Medicare Advantage Plus plan. What is different though is the maximum out of pocket. Under the Medicare Advantage Plus plan, the program will have a maximum out of pocket of $1,470. And this is comprised of your deductible and all of the co-payments that you pay. Once a member reaches the $1,470, there are no additional co-payments that the member would be responsible for. Now that's different from the senior care program because the senior care plan does not have a catastrophic cap. So all of those co-payments will continue and there will not be a catastrophic cap that the member would reach. And this is important for members that do not have the 365-day hospital rider. In those cases, members could be exposed to tens of thousands of uncovered Medicare expenses under the Part A hospital benefit. So under Medicare Advantage, you have that catastrophic protection that's in place that caps you at the $1,470. Inpatient hospital care, both programs would have a $300 copayment per admission with the $750 annual maximum. So if a member is admitted into the hospital 3 times in 1 year, the most that they would pay for that inpatient hospital admission, the 3 admissions would be the $750. Skilled nursing care is covered under both plans for 0 copay for days 1 through 100, which is the Medicare covered benefit period. What's different is the PCP and specialist copayments. So for 2022, the senior care plan will be changing. There will be a benefit change to the plan. There will now be a $15 copayment that members will have to pay for both primary care visits as well as specialist visits. Under the Medicare Advantage Plus plan, the PCP copayment will be 0 and specialist will be 15. The ER copayment is 50 under both programs and dialysis is a 0 copayment under both programs. Now, one of the questions that have come up is in regards to that $15 copayment under the senior care plan and how that works. If after Medicare pays their 80%, the 20% then goes to GHI, and the plan would apply that $15 copayment and then pay the balance. So that's how the program would be, how the plan would pay for that claim. If the 20% that Medicare does not cover happens to be less than that $15 copayment, then the member would be responsible for the lesser of amount. So if there's only a $10 balance that's due after Medicare pays, the member would only be responsible for the $10. Melissa, you can move to the next slide. And before I turn it over to Samantha to go through the prescription drug rider, I do want to just emphasize the fact that the drug rider is not changing. So if you're currently enrolled in the Emblem Health Enhanced Prescription Drug Plan, it will remain with Emblem Health. So there's no change in regards to the carrier. And Samantha, I'll turn it over to you to go over the prescription drug benefit.
Okay, thank you, Kim. Okay, so as Kim had mentioned, most of you today have the GHI Enhanced Medicare Part D prescription drug rider. So the benefits will not change. And if you are currently enrolled in our drug rider, even if you're enrolled in our HIP VIP and you move to the Medicare Advantage Plus plan and you are currently in that rider, you will remain in the rider for 2022. If you are currently in an individual PDP plan, that is one of the biggest differences between a secondary plan and a Medicare Advantage plan. So for the City of New York Medicare Advantage plans, because they are a group-sponsored plan, Medicare requires that you are in a group-sponsored drug plan. So if you are currently enrolled in an individual prescription drug plan, enrolling in the New York City Medicare Advantage plan will result in a disenrollment from your individual Part D plan. So to obtain RX coverage, you would need to go to the Office of Labor Relations website and fill out an enrollment form in order to participate in the GHI Enhanced Medicare Part D. The rate for this rider next year will be $125 per member per month. And then
Thank you, Samantha. I did want to just address a couple of questions that came in advance relative to the prescription drug rider. The prescription drug benefit will not be impacted, as Samantha had said. So it's currently with Express Scripts. It's going to continue to be Express Scripts. So if you have prescriptions that are in place, there's nothing that's going to change. So that is not going to be impacted by the Medicare Advantage Plus change whatsoever. So the prescription drug rider, whether you're on senior care or on the Medicare Advantage Plus plan, will be that enhanced drug rider that you have today, and that will remain intact. The only good news is the premium's actually going down for 2022 to the $125. I did want to give an update to everyone in regards to some of the pieces of information that you have already received or that you will be receiving. Most members, if not all members, should have received their notice of change letter, which came from the City of New York, and that was mailed in August. And it was the initial announcement letter that came from the city. Following that initial notice of change letter will be a pre-enrollment guide. And the pre-enrollment guide was just approved by the City of New York and the MLC, and that is slated to start mailing on September 7th. The City of New York has posted a PDF copy of the pre-enrollment guide on the Office of Labor Relations website. So you can access that by going to the hyperlink and downloading the pre-enrollment information. This is the pre-enrollment guide that all members will be receiving in the month of September. So you will all get a hard copy. In that pre-enrollment guide, it's going to include a summary of benefits document, a comparison document, the frequently asked questions that the city has posted, as well as instructions on the opt-out process. So included in that pre-enrollment guide is the opt-out form, and the opt-out form can be submitted back into the plan either by mail, fax, email. You can log in and electronically opt out if you choose to, or you can call the call center and they will register your opt-out request at that time. When you're opting out of the program, you are agreeing to or attesting to the fact that you understand that by opting out and keeping your current program, you would be responsible for the buy-up premium. So once we receive an opt-out request, we would then send the member a confirmation letter stating that we've received your opt-out request, and this is a confirmation that you are opting out and that you are agreeing or attesting to the fact that you will have the additional premium. Melissa, you can go to the next slide. So following these initial communication pieces will be the membership identification card, which will be sent to all Medicare Advantage Plus enrolled members in December. Followed by the identification card will be the welcome guide, which is going to go into a little bit more detail in regards to some benefits of the program and how you access things. It'll go into a little bit more granular detail. And then in January and throughout the course of 2022, there will be member newsletters that the plan will be sending out to everybody. Members will have the ability to access the evidence of coverage online, or they can request a hard copy by calling the call center. I'm in the process of completing the updated evidence of coverage document to be posted on the OLR website. In the meantime, I will be sharing with all of the union heads a copy of the full benefit summary that's a little bit more detailed. So I know that many of the CSA retirees have been requesting more information. And over the next few days, I will be sharing that information with Doug, who can then email it out to the membership. Melissa, you can move to the next slide. Now, I touched upon this earlier, but I'll go into a little, repeat this information again, which is important, the enrollment and opt-out process. So all Medicare eligible retirees will be automatically enrolled into the New York City Medicare Advantage Plus plan for a January 1st, 2022 effective date. The opt-out period is going to run from September 15th through October 31st. So the City of New York has extended the opt-out period through the entire month of October because the initial pre-enrollment mailing has been delayed by 2 weeks. So you will have a full month and a half to opt out of the program if you choose to. The opt-out process, as I said, you can complete the form and mail it in, fax it, email it, do it electronically, or you can opt out telephonically. The buy-up premium for the senior care program is the $191.57 for the base plan and $2.83 for the 365-day hospital rider. If you're currently enrolled in HIP VIP, that program will also be a zero premium for 2022. So if you are a HIP VIP member today and you want to opt out of the Medicare Advantage Plus plan to stay on HIP VIP, you can do so as well by submitting in the opt-out form, and that premium for HIP VIP would be a zero premium as well. The other programs, the City of New York is working to finalize the premiums with the other carriers. So we do not have the final premium for the Aetna plan or the United Humanas or the Medicare related plan. But the City of New York has committed that they will probably have those premiums ready by the end of this week or sometime next week. And once those become available, I will be sure to share those with Doug, who can then communicate it out to the membership. Next slide. I think we might be at the end. So
if you don't mind, I've been going through the questions and answering as many as I can, but it's a recurring theme, and I think in regards to trying to find their providers. So I'm going to say the number very slow so that you guys can write it down and call our call center. That's 833-325-1190. Again, that's 833-325-1190. The representatives there can help you find the doctors to see if they're in a network. In addition to that, you can also go on the website. I've provided the website a couple of times on the chat, so hopefully you have access to that. So I just wanted to, it's a majority of the questions are with providers.
no, thank you, Marlon. I appreciate that. Some of the specific questions that have been sent in directly to me from Doug related to some specific providers. There was some questions around Stony Brook, Catholic Health Systems, Northwell. All of those are participating providers in the plan. Caremount in Westchester County came up as one of the providers in question. They are participating as well. So many of the providers that you're seeing today are actually in-network contracted providers. So that's where I emphasize, go online, verify directly on the website, or contact the call center to have them verify. I think there was some confusion around the plan name. So some providers and some of the front staff are not familiar with the Alliance or the Medicare Advantage Plus name. So I think that that's where there could be a little bit of confusion. I did want to let all of the members know that there is a simultaneous provider education campaign that's occurring right now. The provider education campaign actually started in August, and it's newsletters and provider portal messaging and email blasts that will continue through the month of September, October, November through December. We also plan to do provider webinars as well as telephonic outreach to all providers. So it's going to be over a course of time where all these providers will be up to speed on everything. So at some, all providers will get the information that they need over the next course of the next few months. And it's started already. So hopefully, as I said, 90% of the providers that City of New York retirees are utilizing today are actually in-network providers. So there's a very good chance that your doctor is in the plan. I just wanted to go through a couple of the other questions just to make sure that I didn't miss anything. One of the questions came up in regards to providers not accepting the program and how this works. If you have a out-of-network provider, because in-network providers are obligated to accept the plan. So if they're an in-network provider, they have to accept the plan, they have to bill us, there's no issue there. But if it's an out-of-network provider that is not a Blue Cross Blue Shield or Emblem provider, they participate in Medicare, that provider can bill the plan, and we will pay the provider the full Medicare allowable amount. So that's where a lot of the confusion comes in from the provider community, is they want to make sure that they are not going to get paid any less than what they're getting paid today. So we will pay the provider the full Medicare allowable amount. Now, if a provider participates in Medicare but does not accept assignment, that provider can bill up to 115% of the Medicare allowable amount. And that extra 15% is what's called the excess charge. The 15% or the excess charge will be covered under the program. So the provider can bill the plan the full 115% that they're legally allowed to under the Medicare maximum billing limits, and the plan would cover the full 115%. The only copayment or cost that the member would have would be the applicable copayment. So if it's a specialist, you would just be responsible for that $15 copayment. If it's a primary care doctor visit, you would have a zero copayment. Now, if there is an instance, and it's usually very rare, where a provider is not willing to bill the plan and the member pays for the service up front, we will reimburse the member, and we will reimburse the member the full Medicare allowable amount. Now, if a provider charges you more than Medicare allowable, they're legally not allowed to. They have to abide by the federal Medicare billing limit rules. So in this case, the most any provider can bill for services is up to that maximum Medicare billing limit. If they accept assignment, it's the 100%. If they don't accept assignment, it's the 115%. If there's an instance where a provider overcharges a retiree, we will reimburse the retiree for the Medicare allowable amount and do outreach to the provider to have them refund the overpayment directly to the member. Our goal is to take the member out of the middle. The last thing we want to have is members paying for services and waiting for reimbursement. That's why we try to outreach early and engage with those providers, so that we can help the provider understand how the billing process works and how the Medicare payment works. So that's our ultimate goal, is to advocate on behalf of the member so that you're taken out of the middle. Doug, is there anything that came up on the questions? I tried to review and address as many as I could during the presentation. Is there anything that you think I may have missed that you want to call out now that I will respond to directly?
Not really. I think that you did an excellent job. There are a couple of things I went through the chat also, like Marlon did, and there were some things that were more applicable directly to our fund. So I'll just address those now. There was one question in there about what happens to your dental benefits provided by the welfare fund. Those are going to continue as they always do. This does not affect your retiree welfare fund benefits. So you have the same choice of 4 different dental plans. You have the same optical benefit. You have the same hearing benefit. Where this new plan has some dental or vision or hearing benefits, those can be used in conjunction with your current benefit to make it even better. So you can have the eye exam done through the Medicare Advantage plan, and then go get your glasses and be reimbursed by the fund. We already provide 4 cleanings a year. If you want 6 cleanings a year, you can go and get 2 more on the plan. When it's time for a hearing aid with our $800 and the retiree chapter $800, you'll get another $500 through the Advantage plan at that point. So this is only enhancing our benefits. The coverage for transportation, the coverage for physical therapy and acupuncture, all can be used in conjunction before you use the welfare fund, which will just extend some of those benefits out. There's a lot of talk, and we have encouraged people in the past to do this, which was due to some of the high cost of medications, to waive the Part D benefit through senior care and go buy another Medicare drug plan. You can, my understanding is, and I've got the experts here to tell me whether I'm completely wrong or not, is Medicare will subsidize your health care either through a Medicare Advantage plan or a drug plan, but not both. So in the past, senior care and the enhanced Part D drug plan was enhanced, subsidized some by Medicare, but that was it. So if you dropped out of that plan and went to a different plan, everything was fine. With the new plan, since Medicare subsidizes the cost of the supplement through the Advantage plan, that's their one-time subsidy. So you can't be in the new plan and in a separate standalone drug plan or in a spouse's drug plan that's also getting subsidized. You're going to have to make a decision one or the other. If you're really in love with that other drug plan, then basically, from where I sit, the only choice you have is to opt out of senior care, pay the additional $191.57 a month per person, and then be in whatever drug plan you choose. Am I completely wrong or completely right? I feel like
No, you have it right.
I feel like Ray Romano talking to guests, you know.
Doug, your audio was cutting in and out a little bit, but I
sorry.
think I got most of it. The issue is Medicare does not allow simultaneous enrollment into the Medicare Advantage plan and a individual Part D plan. So you cannot have both at the same time. What will happen is the enrollment into the Medicare Advantage Plus plan will cancel you out of your individual Part D plan. So what Doug was saying is members need to make a decision at this point. If you want to be in the Medicare Advantage Plus plan, you'll have to take the enhanced drug rider through Emblem Health for the $125. If you choose that you want to keep your individual Part D plan, you would then have to opt out to stay on the senior care plan. So if you're on senior care, you can have an individual Part D plan on your own. The issue there is you're going to be paying $194 to keep the senior care plan to have the individual Part D plan, which will also have a premium. So I think that's where each of those situations need to be an individual evaluation as to what's best for you. But the 125 would actually be less costly for you to pay the enhanced drug rider and keep the Medicare Advantage Plus plan. One of the questions that did come up in the chat and in the documents that were sent ahead of time is in regards to split contracts. What if you have a spouse that's under 65 or vice versa? The non-Medicare eligible spouse or dependent would be enrolled in the GHI Empire CBP plan. So the Medicare Advantage Plus plan will be linked to the GHI CBP plan. So that is how the enrollment will work for split contracts. And there will be a zero premium for both members under the program.
There was a question, I always love this question, is this only for CSA or UFT? I said, no, this is a New York City-wide program. So regardless of whatever union you're in or have retired from, this applies to you. It applies to UFT, CSA, CUNY, fire, police, DC 37, it applies to everybody. We're not just picking on this. And the other question that comes up is why are we doing this against, with the retirees instead of going after those who are still working? In the scope of things in the last 7 years, there have been changes to the health benefits for the active members that have saved the city of New York about $5 billion cumulatively. And now it's time for the retirees to make a small contribution to keeping it going and maintaining the one thing that we have that no other municipal retirees in the country have, which is free basic health care for ourselves and our dependents as long as we live. Those who have New York State retirees, they're paying about 28% of the cost of the benefit. New York City is the only one, to my knowledge, that still pays nothing. And this is a way, with a few tweaks to what has been done in the past, to continue that for the foreseeable future.
There's some additional questions that are coming in the chat relative to underage dependents. If a retiree has an underage dependent child, they will stay on the GHI CBP plan as the underage dependent. If they are a dependent that's Medicare eligible, that Medicare eligible dependent will also be enrolled in the New York City Medicare Advantage Plus program. Question came up about TRICARE. For the individual that has TRICARE, you can continue that for your prescription, so that will not be impacted.
So the people on TRICARE, they can opt out of the drug benefit with this plan and then still get the TRICARE. Is that correct?
Yes, if you qualify for TRICARE for life, that will not be impacted. So that's the one plan that you can keep while you're in the Medicare Advantage Plus program.
Great, thank you. That helps a lot of our members.
So the formal name, I've seen this a couple of times, formal name is, for this plan, is the New York City Medicare Advantage Plus plan. Just wanted to make that clear because I've seen a couple confusion when they're asking in regard, especially when you're looking up the network, you have to look up New York City Medicare Advantage Plus plan. And one thing I wanted to call out, you are getting reimbursed for Part B. That continues. So I've seen a couple of those questions in here as well.
Thank you, Marlon. And the premium for the New York City Medicare Advantage Plus plan is going to be zero premium. So there is no cost to the plan. So for those retirees that were paying that additional 365-day hospital rider, you will not have to pay that under the Medicare Advantage Plus plan. It automatically includes 365 days of hospital coverage. So this is a zero premium, no pension deduction plan for the Medicare Advantage Plus plan.
Right.
And retirees will have the opportunity, if you choose to not opt out and you want to keep the New York City Medicare Advantage Plus plan for 2022, and you go through the course of the year and you decide that this Medicare Advantage Plus plan is not something that you like, it's not for you, the city is allowing you to go back to your old plan during the fall transfer period in 2022 for a January 1st, 2023 effective date. So you will have an opportunity to switch back to your original plan during the next fall transfer period.
Getting a lot of premium questions if we opt out. If you decide to opt out, it's $191.57 for the senior care medical program. For the hospital 365-day rider, it's an additional $2.83, a total of $194.40 per member per month.
Yeah,
so it's roughly about $400 per month for a husband and wife to opt out to keep the senior care plan.
Yeah, and the welfare fund will continue to pay the rider portion like we have for the last 20 years plus for the hospital benefit. So you'll only be paying the cost of the premium, the $191.57, the $283, the welfare fund will continue to pick up. We pay that directly to the city for you and have so that you have flexibility to do some other things. So in a way, this is saving us money because all of you won't be paying $1 a month for you, but those who stick around and stay in senior care now goes up to $2. So we're not going to change that benefit. That benefit will continue as it is.
And one of the questions that came up during the UFT meeting yesterday was regards to the 5-year contract and how the premiums are going to be guaranteed. The New York City Medicare Advantage Plus program has a 5-year guaranteed premium with the city of New York. So that premium will be zero premium for the 5-year contract. At the end of the 5-year contract, we will have the ability to extend the contract with the City of New York. For the senior care benefit, that program is renewed on an annual basis. So the premium will change each year. So we do not know what that premium would be for 2023, but it does change on an annual basis.
Another, I see folks are trying to access the Find Care tool. You have to make sure you click on guest, because if you don't, you may not. I'm seeing questions on. I don't see Florida. That's for like members. They'll pop in. It goes in automatically into their search tool. But if you are going to go on to the empireblue.com website, click on guest, then you click on medical, you select the state, Florida will pop up under Medicare, and then you have to select for network, New York City Medicare Advantage Plus. Sorry, Kim. I'm reading through the questions and I'm trying to get some answers out there.
And during the 5-year period, members will have an opportunity to switch between the Medicare Advantage Plus plan or the senior care plan during the fall transfer period. So those are the 2 plan options that you'll be able to switch back and forth between during the fall transfer period.
Okay, I'm going to see if there's some others. There were some questions about Social Security deductions and Medicare. That stays the way it is. So whatever Social Security and Medicare tell you that your Part B premium is, this plan has nothing to do with that. That's based on your taxable income 2 years ago, plus the base amount that's adjusted every year. So you'll continue to be paying the Medicare Part B premium from your Social Security check. If your income qualifies you for IRMA, you'll continue to pay the Part D IRMA, and the city will continue to reimburse both the standard Medicare Part B in April, and provided you've applied for the IRMA for Part B in October, and we will continue to help you with filing the IRMA documents.
And one of the questions came up, if you are on the provider finder tool and you get to a screen where it's asking for a 3-digit alpha code, that code is N6Y. If you happen to get to that screen, some members are searching on the online tool and are actually getting to that screen. So that alpha code is N as in Nancy, 6, Y as in yes. For the Medicare Advantage Plus program, the dependent spouse premium is 0 as well. Marlon, do you see anything that's jumping up that we should address?
There was a question that came about emergency services and like tests, like somebody needs emergency heart surgery and the test associated with that. So my assumption is that if you're in an emergency room and they say that you need a CAT scan, you need an MRI, you need whatever, that that will be given, and that's not part of the pre-approval process, obviously.
In an emergency situation, there's no need for prior approval or any of that. That's all going to be handled with directly between the plan and the providers. So we don't have to worry about prior approval in an emergency situation because the member has no control over that. So if you're in the emergency room and they have a bunch of tests that are being run in an emergency situation, that'll all be covered they'll go through without the prior authorization process. If one of the questions that did come up in regards to co-payments, if you go to your doctor and they do multiple things in one visit, so for example, they do a blood test, they do this procedure, or like you go to a dermatologist and they do multiple things at the dermatologist, that's all included with the one co-payment. So the member would be responsible for one co-payment for everything that happens within that single provider visit. Now, if a member goes to their cardiologist in the morning and goes for an x-ray in the afternoon and goes to the dermatologist later on, that's 3 separate visits. The member would be responsible for the $15 copayment for each of those separate visits.
think one of the questions was on teledocs, on Life Health Online. It's a zero copay when you utilize the teledoc, which is our Life on Health application. So, I mean, personal story, when you use this, you know, a lot of times, especially from my experience with retirees, emergencies tend to happen in the evening, in the nighttime, you know, or concentration or anxiety goes up. The Life Health Online tool is a perfect opportunity to engage with a doctor, ask questions. If it's an emergency, we always going to encourage to go to the emergency room. But a lot of times, if you need that extra consultant, a doctor's visit, you can leverage the Life Health Online. In addition to that, you do have the 24/7 nurse line as well. It's one that I've personally used when my child had a rash. You know, I called them. I didn't know if I needed to go. It was late at night, needed to go to the emergency room or not. I gave him a little Benadryl, and it made this parent very happy. So everything worked out. So you have two tools that you can use. That's the Life Health Online, which is a $0 copay, or you can use the 24/7 nurse line.
I see a couple of questions that are coming in about clarification on the prescription drug rider and the cost. The enhanced prescription drug rider that's currently offered through Emblem Health will continue, and that premium is $125 per month for the prescription drug rider that's through the city. I also wanted to let the individual know that New York Langone, Mount Sinai, Northwell, they're all participating in the Medicare Advantage plan.
There's one here about diabetic supplies and testing things. There's no change to that. You know, that's a Medicare. If it's covered by Medicare, you're good to go with that, I'm assuming. And also with the drug plan, there is no change with regard to where you can get your medications. It's still being provided by Express Scripts through Emblem, but because you're Medicare eligible, you don't have to use the mail. You can get your prescriptions at CVS, Walgreens, wherever you want to go, just like you do now.
I also want to reemphasize, there are no referrals. There are no gatekeepers, right? This is a PPO access. If you want to go see a specialist, you can make an appointment. So once again, there are no referrals with this plan.
There is a question came up about Columbia Presbyterian. They're also participating in the program, so they are an in-network PAR hospital as well as the providers. And I just want to emphasize to the retiree group that's on the meeting, the chat functions, they're coming in fast and furious. So I apologize if we're not able to get to them. Sometimes they're going by quicker than I can actually read them. So if there's any additional questions that come in that we have not been able to address during this presentation, please, Doug, pass them on to me. I will be more than happy to respond to any individual questions that come in.
There was one comment here in the chat. For those that want to opt out, will I help? Yes, we will be scheduling a couple of presentations to go through the opt-out procedure with you and explain it in more detail. We don't need the folks from the Alliance there. We can provide that information to you. So again, we will schedule them. They'll be on Zoom, and we'll schedule at least two with ones so that our friends on the West Coast don't have to get up in the dark to participate. And we'll go through and answer any questions you have. If there are things that we still can't answer, we will refer them to Kim and her team, and we'll get answers back to you as soon as we can.
And one last question before we wrap it up. Someone's asking about what happens if a retiree passes away. Does the spouse get to continue the coverage? The surviving spouse would be able to continue on the plan, and they would pay the COBRA premium to stay on the program. The COBRA premium for 2022 would be $7.50. In 2023 and on, it would be a zero premium. So surviving spouses are able to continue the plan through the city and pay the premium for the plan. ProHealth is participating providers in the plan, yes.
Good.
Well, Doug, is there anything else you want us to address?
I think that's pretty much it. What I'm going to do is I'm going to let you go. I appreciate your time. I'm going to stop the recording, and then I will go through these question and answers for people. And if you want to stick around and listen and get your question answered, that's fine. But I don't want to take that time. And I thank Marlon and Melissa and Samantha for their expertise. And as Mr. Canizaro had said, I've heard them speak a number of times. I learned something new every time, and we're very appreciative of having you and having the opportunity to have you here with us. So, thank you.
Thank you, Doug. I appreciate the opportunity, and I hope our team was able to answer as many questions as possible. We will be holding education presentations throughout the month of September and October. So retirees will have additional opportunities to hear the presentation, get more information through the course of the next 6 weeks. So I encourage CSA retirees to join one of the public sessions that we'll be holding during the month of September and through October.
How are they going to know about that? Is that going to be through the city? Is the city going to send something out about that, or?
It's set up on the hyperlink that the City of New York has posted on their OLR site. So that site has a listing of all of the general session meetings with the links to those meetings. They're going to be starting September 13th through the month of September and into October. Doug, I'll be more than happy to send that information over to you so that you have a listing of the meetings.
Thank you. Okay. Yep, I guess that's it, and we thank you.
Thank you so
Thank you, I
much.
appreciate it very much.
Okay.
Thank you, everyone.
Okay,
Take care.
Have a good day.
bye-bye.